Great. Welcome everyone to today's closing webinar for our virtual conference, Global Communities, Local Challenges and Partnership Solutions. I'm Dr Justin Varney, the Director of Public Health for Birmingham City Council, and it's my pleasure to welcome you to today's session. We will be recording today's session and it alongside the other presentations that we've had through the conference will be going up on the YouTube channel for the Healthy Brum account. And it'll probably take us about a week or two to get them all edited and up. But if you Google Healthy Brum in YouTube, you'll be able to find the channel where everything is. So do keep an eye out because there have been some really brilliant sessions over the month and there's quite a rich amount of stuff to have a look at. So what we're going to cover today, we're going to talk a little bit about what's happened over the month, and then we're inviting 3 of our poster submission speakers to give short presentations about the work that they've done, and then we'll be announcing the winner of the poster competition. But first of all, I wanted to share some reflections on the conference over the last month and really kind of share some insight into why we did what we did. So as many of you know, Birmingham is going through a significant period of financial restraint, and originally we'd been planning to have a face-to-face conference in October as part of our Black History Month celebrations, but going beyond purely our Black African and Caribbean communities to think about the breadth of racial disparities. And when we moved into financial restraint, obviously we weren't able to spend the money on face-to-face conference events anymore because they are quite expensive. And so we flipped to this model of a virtual conference. And we anchored the conference around 3 key areas. So shine a light on the issues, celebrating and connecting with communities, and sharing and emerging practice and learning. And the focus was very much on linking to initiatives and approaches that reduced ethnic health inequalities and also built on the recommendations and the opportunities of action set out in the Birmingham Lewisham African and Caribbean Health Inequalities Review, the Black Year Project. We also asked that webinar submissions linked across to our ICS 10-year strategy and our Health and Wellbeing Board strategy. And we hope by anchoring to these 2 strategies that we as Birmingham would be able to learn from others across the country and help inform our approach, but also recognising that many of the things that are core pillars of these 2 documents are common across many other local authorities and integrated care systems in England. So we weren't necessarily going to exclude a huge amount by using this approach, but it helps tie in at a local level how this connects back to what we're doing and influence our strategic approach to implementing these strategies by drawing on good practice from across the UK and potentially across the world. So in the next slide, it just gives you a bit of a flavour of what's gone on over the last month. So we've had 37 webinars, 24 different organisations taking part, and we averaged about 27 people in each webinar. And one of the brilliant things that I think we've seen in this webinar approach is we've seen both organisations from across the UK contribute their learning and their wisdom to us in a way that they might not have been able to if it was a face-to-face event. So this has enabled much broader participation from speakers. We've been able to celebrate and shine a light on some brilliant work done by new and emerging organisations and those that aren't necessarily on people's radar, as well as some that we've specifically been working with within Birmingham. And that I think has been a really positive part of the approach, and the webinar approach has given us that. One thing I'd also say from the webinars is that it's enabled people to participate from a much larger kind of footprint than a face-to-face would. And therefore, we're taking the learning from this conference and applying it to a similar virtual month-long conference in February, focusing on health disparities affecting our lesbian, gay, bisexual and trans community, because we feel it has proved a successful approach. Just moving on to the next slide, it gives you a bit of the first cut of feedback, and Eloise, I'm sure will pop in the chat the link to the evaluation form as well, but we have asked people to the feedback on the webinars and give us their views. And as you can see, the overall average feedback on webinars has been extremely positive. The vast majority of participants indicated they would be actively using the learning from the webinars in their work, and that they would recommend the conference in the future to others. And I was particularly struck in a session I was participating in yesterday jointly with London, sharing Birmingham and London's approach to seeing racism as a public health issue and taking a whole system approach to tackling racial disparities. And the feedback from participants was incredibly positive in the chat, but it was also really interesting to see some of the connections that were made through the chat from different participants in real time through this kind of virtual networking event. So I think there are many things that are starting to spin out from the webinars in terms of positive networks of change and opportunities there. We also collected some demographic information on participants, and the next slide will just show you a bit of that. As you kind of expect, Birmingham City Council staff are overrepresented, but that's not a bad thing, and it's important, to recognise it is a Birmingham-based conference, so we do want to get good representation from local staff. We saw a range of ethnicities represented, and a range of countries of heritage, and a range of roles as well. And that's part of the opportunity of this virtual type conference to engage a broad range of people, both as presenters and as participants. And as we upload the videos to the YouTube channel from the webinars, I hope that we will further continue to promote awareness through those sessions and increase the audience reach for them. And I know that we have already had a range of requests around specific webinars from people who weren't able to make the time slot, but do really want to learn from the presentations and the discussion. So once those are live in about 2 weeks' time, please do check them out on the Healthy Mum channel. So that just gives you a bit of a snapshot into what's happened over the last month, and I think it has been a really positive virtual conference, and certainly the first one I've experienced at this scale and breadth, which I think has been really exciting. And I will say thanks at the end, but a big thank you particularly to Eloise Watkins, who's led the work on this, and the students that have worked with her on student placement from Aston University as well, which has been a really valuable support. But without further ado, I'm going to move into the poster presentations. We ran an ePoster competition. It's the first time we've done this. I think it's fair to say many organisations and individuals were still not particularly familiar with what a poster competition is, so we didn't get a huge number of applicants, but as always, it's quality rather than quantity, which is what's important. And we did go through a panel process of judging them, and after the presentations I will announce the winner of the poster competition, who'll get a nice certificate to frame and put on their wall afterwards. But it is, it's something that we want to continue to build, because particularly with health, posters and academic posters are a way of presenting evidence and getting it logged in the system so that people can go back and learn and continue to learn from good practice. So we hope to continue to build on this model moving forward, because I think it is a great way of capturing what you're doing and sharing it with an audience in a different way. That being said, I think there is also real value in writing a poster like this, and I'm sure that those presenting will reflect on, actually it's quite challenging when you're trying to condense everything you're doing into a poster, and how you choose your words, how you choose your images actually takes quite a lot of work and quite a lot of effort. But when you step back from it at the end, you really have your elevator pitch on what your project does really kind of tap down, and that's a really important part of this journey. So really delighted to be joined by speakers today to share their reflections on their posters. The next slide just shows you the 4 posters. They are going to be tiny on your screen, but we'll be going through 3 of them in turn, but it gives you a sense of kind of what came in and also how different they looked. And one of the joys of this kind of poster presentation is people have really different styles, and that's great. That's a positive thing to see, because all of us receive information differently. Some of us are visual learners, some of us are oral learners, some of us are auditory learners. We all learn in different ways, and how we receive information when it's done in this kind of poster is different for each of us. So some of them will speak more to you than others, and that's fine. That's absolutely normal. And it's part of why having this diversity is brilliant. But without further ado, I'm going to invite Patricia to be our first speaker and to talk a little bit about the poster that came in from Richmond upon Thames Borough Council about the great work they've been doing with community health champions. So Patricia, over to you. Oh, you're still on mute, Patricia.
Can you hear me now?
We can. Thank you very much.
Okay. Well, good afternoon, everyone, and thank you, Dr. Varney, for the introduction and also on the short update. My name is Patricia Canny Fitzgerald, and I work for Richmond upon Thames Borough Council in London. And my role is the Community Health Champions Coordinator. And as you rightly said, Dr. Varney, trying to condense information, like this, because there was a lot went, behind the scene. And of course, you cannot fit everything on the poster, but I'll try my best within the 10 minutes to elaborate on what we've got here. First of all, I just want to say that Richmond Borough Council is one of the most affluent boroughs in London, and it's very white as well. And the thing with Richmond, I remembered when I was called upon to lead on the Community Health Champions program. I looked through some documents from public health and find out that they only had about, I think it's 16% ethnic minority. And also the way they're not in communities like you find in any other boroughs or in most boroughs that I know, like Greenwich or Lewisham, and I'm sure Birmingham, where you've got communities settled, where Nigerians are, Ghanaians, Sierra Leoneans, Caribbeans. Richmond is not like that at all. So recruiting the community champions was rather challenging. So I have to devise a smart way of doing it by finding out about, working with the housing associations to find out where ethnic minority, residents were dotted within the borough. So I got all that information and I did some programmatic campaign to try and recruit champions. And sometimes I go within those communities as well to identify those people and approach them and tell them about the program and try to convince them to be members. And so we did a recruitment. We've now got about 120 champions, of which about 26% are from BAME community. So that is an achievement for Richmond. 80% are women, 20% men, and 44% are below the age of 50. Because of course, those are the sort of people who want to, attract, because usually people who are champions within their communities are mainly retired people who have plenty of time, to commit. But this is a breakthrough that we've got about 44% who are under 50. But going back to that's just a brief overview of Richmond and the Community Health Champions. But going back to the presentation, this presentation mainly was about addressing the priority themes like shine the light on issues, celebrate and connect our communities, and also about addressing health and well-being board strategy priorities. One was food. Food is very, very important, especially in our Black community. I think it is important, and healthy eating is one of the biggest challenges, and bringing people together and devising a way where we can create recipes we can eat together and make it fun, I think is very important. But what we did in Richmond was that the community champions decided after the winter health fair that we had last December that we need to do a summer health fair. And we won the theme about food. So we came together with a strategy, sat down, and the good thing about this is this came from the champion. So all the council had to do was say, listen, we've got the resources, we can fund it. So can you get a venue? Can you create your own poster? And we fund all that. And they went away and did all that, got a venue date, we helped with the publicity. And then we held this event in July. And it was really, really great. We had a West Indian group called Dockers who used various, vegetable fruits to create healthy drinks, puree, and food, which was such fun, and people enjoy it. And because within our community as well, it's about what we're used to. Sometimes it's about, it's not that we don't want change, but it's I don't know, we're scared of the unknown, something that you haven't tried before. But I think what encourages us to venture something different is when you have someone like us, your own brother, your own sister. And by that, I mean someone that you recognize with, do it. I think that's can influence you, to change the behavior. So that's the approach we use. On that day, the event was attended by about 170 people, and we had the most fantastic feedback. And what this program have done as well, the Champions program in Richmond has helped make previously invisible communities within the borough more visible and engage in borough and public health initiatives, which was something that they found as challenge before, because I said the Richmond is very different. It's not like you can go somewhere, we've got a church there or mosque where you can actually approach people. It's not like that at all. And also with the minorities comprising just 16% of the population, it has been, breakthrough to show that they're there and they very much want to, engage with us. And this is something that we're going to continue to pursue. We've got some more funding that we've invested in that to ensure that we as a borough address health inequalities, but by working with our BAME community and listening to them and let them take the lead. Because what we've done is we've got this group of people now who are willing to engage with us. And it's like building a bridge and letting that bridge, collapse. So what we're doing here is strengthening that bridge by investing in it and creating training for our champions so that they can go out there and be confident in addressing health inequalities and helping their communities. So I know I've only got 10 minutes. I don't want to go too much, but really in a nutshell, that's what this case study is about. So thank you for listening to me.
Great, thank you very much, Patricia. And I'll just pause and see if any hands go up, if anyone's got any questions. One question I have perhaps for you to share with us is, you talked about some of the challenges of finding, in effect, community champions in a borough which doesn't have a kind of designated, this is where all the people that live from a particular community are. And I just wondered whether, as now the champions are there, is that opening up a kind of slightly different understanding of Richmond upon Thames, in that their way of describing place and community in the borough is informing and changing the way the council thinks?
Yes. I think that is, in fact, what we're doing with the champions. We've got a monthly meeting, and with those monthly meetings, we invite very senior members of the council. So they attend those meetings and they hear exactly what's happening on the ground, whether it's individual experiences or what's happening, to people within their localities, and they take that back to their teams or whatever, and that does help to influence change. I can give you an example as well. Our champions, and 15 of them were Black, were actually involved in the Richmond 10 years dementia strategy. And they contributed immensely to that report. They are even cited in the report because some of these people have lived experiences. Some of them were carers. So yes, it is definitely making a lot of traction. The council is listening more. They're understanding the needs of our Black people more within the borough.
Great, thank you very much, and thank you for sharing. And if any colleagues have other questions, do pop them in the chat. And I know Patricia will keep an eye on that, and I'm sure we'll answer in there. But thank you very much for your presentation. I'm now going to invite Peace to share with us the presentation poster from Cannes. So over to you, Peace.
Yeah, thank you. Ilson, do you want me to share my screen? Because I have a short video afterwards, or do you want? Okay, thank you. Thank you. Yes, so hi everyone. Good afternoon. Thanks, Fanny, for the introduction. My name is Peace Yamja, and I'm the Health and Wellbeing Development Manager for Caribbean and African Health Network. And our vision is to eradicate health inequalities and wider disparities within a generation for Caribbean and African people. And our priority centers around providing culturally appropriate community services for people in our community, and also improving health literacy for our community for Caribbean and African people. And lastly, influencing health policy and insights. And in terms of our health streams, so we have six health streams: cardiovascular disease, mental health, respiratory conditions, cancer, and two others. You will see that on my screen, the backdrop. So we have six health priorities. But what I'm here today is the poster presentation. And one of the projects we did in Salford, empowering the Salford Caribbean and African community for heart health. So the poster is on my next slide. And it was a unique approach, beneficial for long-term benefits for Salford residents. And it was targeted at improving health literacy, creating that awareness, and then supporting people with long-term condition. So we took an approach building from the learnings from the COVID-19 pandemic on ways of engaging the Black community. So in terms of improving vaccination uptake and then prevention of the COVID vaccine. So in terms of our aims and in terms of objective, we set out to increase health literacy in 1,200 people in Salford, and also screen 500 people. In terms of screening, it's included screening for high blood pressure, atrial fibrillation, and pre-diabetics by volunteer nurses in Cannes. And then also another objective was also to recruit 12 health ambassadors, which included faith leaders and also people who had businesses in the community, and barbers and hairdressers. So just like I said, building from the learning of the COVID-19 pandemic on ways of engaging people from our community, you realize that sometimes people take information better when it comes from people that look like them or come from people that maybe are in the same space. So just take, for example, when we train health ambassadors and the cohort of people we recruited, we had faith leaders there, we had hairdressers, barbers, and community leaders who had great influence in the community and were able to have culturally appropriate conversations with members of the community. So in terms of the training, and we trained the health ambassadors for a couple of weeks on cardiovascular disease prevention and then management around healthy eating, healthy lifestyle. What does it mean? And all of that. We had role play sessions where we wanted we took turns, and the health ambassadors took turns on practicing culturally appropriate ways of how they could speak to community members around health, heart, cardiovascular disease management and prevention, and then encouraging them, empowering them to take up this challenge, take up what's the learnings they got from the training session, and then passing it on to community members around how to modify their lifestyle, going in for screening, um, constantly checking their blood pressure, um, and then engaging in physical activities. So the next slide I'll be sharing is just a quick video in terms of like the testimonials we got, but then for our results and what we got, the outcomes of that came from the projects were enormous in terms of the um, top health ambassadors saying that, oh yeah, it was an eye opener to them for the training. Also encouraging people to, we had weekly health webinar health literacy sessions where every Saturdays by 11 a.m. we have Black clinicians talk about health conditions that disproportionately affect people in our community. And then so there's a presentation done on a particular health condition. And then people have the opportunity to ask questions, following up with a one-to-one conversation. And then on Tuesdays, it's focused on more on nutrition, where we have Black nutritionists and dietitians talking about some of these health conditions and how that relates to diet and physical activity and making better lifestyles decisions. And so in terms of like the results and then conclusion, we screened successfully over 40% of individuals, empowering people from the community around cardiovascular disease, and they were able to like pass it on to members of the community, family members, who then passes it on. So it was like a step down training period for them in Salford. And then the project offers valuable insight for future efforts to improve health indices in diverse community. And this approach, which is led by Khan, is surely a stepping stone towards a healthier and more informed society. So just before I bring down my slide, I'll go on to the next slide, just briefly talk about testimonials.
We decided to bring together groups of nurses, doctors, pharmacists, nutritionists, physical instructors. We brought them all together. We took our army of people and we went around churches and we went around community centres and we did screening. And we have screened, and I wrote the figure down, and I think it's almost 4,000 people. Since 2017, we have screened.
Glad I went to this program. It teach me a lot, as well as in my family, in my personal life as well. My family, they suffer a lot with high blood pressure and diabetes, and they don't take anything until the end that they've been ill. They're sitting down, they can walk and everything, and there's not enough time to treat it. So everybody who's gone in my family is just diabetic, high blood pressure, diabetes, high blood pressure. So this gave me a really good platform and opportunity to teach my family as well.
And I'm really, really grateful to Khan for giving me this opportunity. And also I'm very grateful to John, who has always been looking after me, who has always made sure that I don't miss the Zoom trainings. Please for keeping asking me, how are you today? How are you doing? Every time I lag behind. So I'm really grateful Tukan for organizing this, and I intend actually to give 5 to 10 minutes to cardiovascular health issues in every meeting that we have at Eritrean community meetings from now onwards.
Again, we're a community whereby we believe in everything's faith. There are things we don't need to pray about. We can manage by ourselves. So KASIH has been a part of it's been a part of me that is imparting life around me. I've learned a lot from the lessons we had. When John told me about KASIH project, I was excited in the spirit because not only that I'm a pastor in a church, I work in the community. I have done youth pastoring, and also I work with people in a homeless situation. So I see life events, I see people suffering from ill health because of partially what they eat. They are causing their part of the problem. So, but due to you don't have enough information, you are limited in knowledge on how to deal with that area. So we resort to prayer and fasting and I'm being real. So, but the fact that I get involved with CAN, get involved with KASIH program, I was able to be empowered and informed. And now I'm using the knowledge I've acquired from the training to impact people around me.
I meet a lot of people from my barber shop, and through this training, I've learned a lot about my well-being. I've learned how to manage my blood pressure, my salt intake, my fat intake, healthy living, healthy eating, and everything. And I want to use this platform to help my community, to help the people around me. I've recently lost 2 of my friends through cardiovascular disease, and I want to use this platform to let people know that they should be able to look after themselves well, to take it serious, because this is a silent killer. We've learned a lot here. I've met different people, and we share a lot of experience, and which I want to share with people. So I will now be streaming it live on my shop every Saturdays morning. I'll be giving leaflet out and educating people about this issue.
But most of our
Yeah, because of time, I would stop the video there, but it's available on our website and you can watch the full version better. Thank you.
Great, thank you very much, Peace, and a really good overview of the work. And I would just pause and see if any hands go up. But while they do, one thing I'm sure colleagues will be quite interested in understanding is kind of as the project kind of finished, because as I understand it was kind of a funded intervention, how and if there's a kind of network that the ambassadors become part of after the intervention. So in effect, one of the challenges we have with these kind of health champions programs is they last as long as the money does, and then you're left with a group of people who are built up and supported, but then if the support falls away, they've got nowhere to connect to. So I just wondered how CAN was wrestling with that challenge.
Yeah, thanks for that question. I have some other colleagues on the call who may want to chip in, but then even after the funding's over and then the sort of targeted project, we're still in touch with our health ambassadors, always checking in, encouraging them, and then even at our events, they would come with their put on their t-shirts and then encourage people to go for screening and all of that. So just still keeping in touch with them, and then we've been getting feedback that what they've learned, they're still passing it on, and that has not ended even after the project. So is that they were empowered and they know the importance, and so it's not going to stop, hopefully. So
great, thank you. And I think also it kind of reinforces never underestimate the power of a t-shirt or a certificate or a badge. Actually, that gives people credibility in communities. And one of the things that struck me really by your presentation was how people aligned with the kind of brand and the brand narrative of the KASIH program, and that I thought was really good. So let's check.
Sorry, I was also going to mention that and also the weekly webinars have also not ended. So every Saturdays and Tuesdays in the evenings, we still have that health literacy sessions, and then our ambassadors are also encouraged to join in those sessions as well and invite their family members, community members. So yeah, it's still ongoing.
Great, and I do know you promote those sessions through Twitter as well and social media, and other people can join them. And I've joined one or two in the past. I really recommend colleagues have a look, because it's one of the really powerful things I think CAN does well is have members, clinicians from the communities talking to the communities. And in local areas often we struggle to find, we may not have the diversity in our clinical workforce. So it's a great resource for colleagues across the country to be able to tap into some of the work that you're doing. Thank you very much, Peace. I'm going to move us on now to our next poster presentation, which I think is Rupert and Paula joining us from Dorset. So Rupert and Paula, hand over to you guys to talk us through your project.
Hello, thank you. Is it okay if I share my screen?
Yes, Eloise will stop sharing to allow you to.
Thank you. Is that visible to everybody?
Yes, it is.
Lovely, thank you. So thank you for having us here today. Yes, we're all the way down in Dorset. So at least I haven't had to travel. I suppose that's the great thing about Zoom. We're talking about a collaborative project that was put together, and it was in response to COVID-19, called Trusted Voices. And it was an initiative started by Public Health Dorset, Dorset Community Action, of which I'm the operations manager, and Community Action Network, which is our sister organisation, which works across Dorset as well. It was set up really to connect communities through the voluntary sector that were most hesitant about taking the COVID-19 vaccine. And of course, what started to come out as we sort of got into COVID-19 more was the disparities in health outcomes and take up of vaccines for different parts of the community. And so it became really vital that there was a way to reach into communities and work through those trusted voices, those community groups that were already set up. As we came out of COVID-19, we realised that there was still a need when it came to general public health messaging, and that actually a lot of the messaging was still not really effectively meeting those community needs. So we started looking at where we would prioritise, and because the Black African community had actually shown the highest level of vaccine hesitancy of any group, we thought that this was probably a good place to start. And we were really lucky because Rupert, who's on the call with us today, was a Trusted Voices champion, and he's also chairman of Nigerian community in Dorset, which is a group that supports Nigerians in Dorset around accessing services. So the link was really, really vital to make, and Rupert was fantastic in supporting the work that we were looking to do. So I'm going to hand over to Rupert now just to introduce himself and the group, the Nigerian Community in Dorset group.
Thank you very much, Paula. Good afternoon, everyone. So my name is Rupert Ogwazo. I'm the chair of the Nigerian community in Dorset. I'll just talk quickly about Nigerian community in Dorset, who we are, what we do. And you can just take the words apart, really. We're a Nigerian group representing all Nigerians within the Dorset area. However, exception to that, we're actually open to everyone. So we're actually open to all Africans and anyone else, like even people who do not identify as Nigerians, but identify as Black people. We're in Dorset, yes, but we're also open to anyone else from everywhere else as well. And then what do? Community. We are a community group. We come together, we support each other, and we try to network within ourselves to create that network, that bond between us. And also we give back to society. That's some of the key things we do. And then relating to this project, we actually educate our people. So I think like Paula said, there was that it was from COVID when we realized that we can use the power of virtual meetings and educate our people. So we started having our meetings on Zoom, and then realized that, like Paula said, there was the need to talk to people about COVID, and then segueing from there, we decided actually what's the gap there? What are the areas that we think were most disproportionately impacted as Black people? And three key conditions came to mind. It was diabetes, because it was the way we're made up, we were affected more than everyone else. Mental health, because it's something we don't talk about as Black people. Just don't talk about it. We pray about it, we wish it away, but we don't talk about it. And it carries this stigma within our society. We don't realize that there's a spectrum about mental health. It's just a case of binary for us. You're either here or you're there. And then finally, prostate cancer as well, which was quite a big one as well, because we realized that we were the most disproportionately affected, compared to everyone else. And this is where we reached out to trusted voices to say, look, how do we educate our people around these topics? And I'll just pause there for now, and I'll let Paula carry on with what we did and how we did it and what the impact was.
Lovely. Thank you, Rupert. So just see if I can get my clicker to work. So what we did and what we learned, well, probably what we learned was not what we were expecting to learn when we started out. So research into why there is this hesitancy around the COVID vaccine, what came across was around mistrust of health professionals and also historical factors that led people to see a white bias within health. Also that Black people had been used as experimentation when it came to new medicines that had come in the past. So there were lots of factors there to unpick. And what we hoped was by improving access, so creating a straight pipeline between the health professionals and the community, we would negate a lot of those factors. Unfortunately, what we found was that an awful lot of the presentations were still incredibly Western. They hadn't been adapted at all for the Black audience or for the cultural impact of the things that were being said. And even things like food wheels that were used were often of a Western diet. So although the health professionals had often given up their own time to come to these presentations, put an awful lot of work into them, and we had improved access, we hadn't necessarily improved the quality of the messaging. And so what became really clear was that actually presenters themselves need support, particularly in an area like Dorset, which is predominantly white. So therefore, the predominant number of health professionals are going to also be white, so won't necessarily have personal experience of the group that they're talking to. So we put in place a kind of collaborative learning experience for the people that put themselves forward to present, where we would actually support them with templates and resources that they might need in order to be able to adapt the messaging so that it fits the needs of the audience. And from that, what really came out as well was the importance of health literacy and the fact that there's often a massive mismatch between health professionals and the way that they talk about conditions, particularly something like diabetes, and the awareness and the literacy ability of the audience that are hearing, who don't have necessarily technical knowledge or an understanding of biology when they're hearing what's being said to them. So we put together this sort of comprehensive package, and we've begun working on that now, working with the presenters who were really grateful who've taken part and taken the feedback really well and understood that actually it's more than just access, it's also about improving messaging. And we're really obviously incredibly grateful to Rupert and to all of his community who also gave great feedback as well to help us to understand where the messaging was wrong and where it needed to be improved. So from this, there's been a real learning, I think, by not just statutory, but also the charity sector as well that have been involved in the project, in that there's more work to be done, a lot more around improving the messaging to make sure it meets the needs of the community. So going back to our main slide deck, I'm just going to move on to what we did next. Oh, which actually I've just taken you straight back to where we were. Let's try that one again. Okay. So as I said, we put together support for presenters. So we get them a series of questions to look at to make sure that they are not just pulling up the same slide deck that they use with every other audience, and in some cases with other health professionals. We put together an invitation to present pro forma so that we made explicit what we were asking from them was not just to come and to deliver a presentation to a particular targeted audience, but to make sure that their messaging was also targeted to that audience. We gave very clear outcomes and assessment measures so that they could review their own session and be able to see whether they met what was needed from them. We're now in the process of testing this with Dorset Blind Association. So we've done a few sessions with their membership to find out what their membership need, so that we're making sure that we're addressing the needs that they see as important, not necessarily us deciding what's best for them. And then from that, we're helping support presenters that have been identified to make sure that the messaging meets the needs of that particular group. So I think the big takeaway for us has been about making sure that you know your audience. It's not really just good enough to say, well, we came to where the audience was. We need to make sure that we're giving the messages that they need, and also that we're doing it in a way that meets those needs. So I'm just going to stop sharing and just ask Rupert whether there was anything else that he would like to add.
No, I think the only thing I probably just add quickly was as a consequence of this results of this discussion we had, one of the most impactful ones actually was the prostate cancer, and I think one thing I found interesting was most of the attendees were males, even though it was open to everyone. People were openly discussing the topic, which I think potentially they may not have done if in different circumstances. I think some of the feedback is that we've actually had people go to the GPs, request tests. And I think one key thing, we had a GP as well, Nigerian, who was there as well, and he was able to present from a GP's point of view as to what we should request, what we can request from our GPs. And I think that was one of the most impactful. Thank you.
Great, thank you, Paula and Rupert. Really good presentation, and I think really and really resonates actually with some of our similar experience. And one of the reflections from one of the early webinars, which was it kind of almost a sadness that it took COVID for public health to really understand this. That we needed to go beyond the BAME, and we needed to have a better, more granular understanding of our communities, and it's so heartening in many ways to see actually so many parts of the country now getting into this space. The statistic on prostate cancer and the increased incidence in Black men has been around for decades. Yeah, we've kind of ignored it, so it's brilliant to see it come through. I just want to ask a question really to both of you. And Rupert, you kind of alluded to this, that your organisation predominantly is around Nigerian community, but open to a much wider audience. And certainly in my own part of the world, we are wrestling with how, because we have large communities of Nigerians, Somali, Ghanaians, are our three largest. How do we wrestle with the way we homogenize African communities into a single word? And you don't recognize the difference. And I just wondered how you were navigating that, particularly in the context of Dorset, where you like to have much smaller populations of multiple African communities.
I mean, to answer that question, interestingly, we haven't, I think if you know Dorset, you know that you are the exception. I mean, I've been to Birmingham. I'm actually in London right now, because I work in London. So I know that Dorset is different. It's pretty much the 1 in 10. And I think to the majority white population, they don't see that difference. To most of them, Africa is a country, simple as that. So to that extent, we actually go for a more united Africa, and that's why I say we're open to everyone, because we accept that it will take a long time for the indigenous population to recognize the differences between Ghanaian and Nigerian and Somalian and South African. So we just go as one body, speak with one voice, and we actually know that we can be more impactful. We're holding hands together and approaching, if you like, society together.
I would definitely echo everything that Rupert's just said. I think I would add that when you are the difference, as Rupert said, then I think you might be more likely to group with other people that are different like you, even if they're not exactly like you. So there probably is a greater willingness to do that. I think the challenge is for the professionals to be aware that in an area like Dorset, that is not necessarily an homogenized group. But then rarely any group is. But I think there's an importance to recognise in somewhere like Dorset that actually there may be a banner of Nigerian, but it's probably naive to assume that everybody in the group will be.
Great, thank you. No, really useful reflection. And I have to say, it's one of the pleasures of the conference and of the posters actually is it reminds those of us that are in urban centres where we live in really globalized populations that actually how you think about this in a less diverse population needs to be intentional, but it can't be a one size fits all. There is transferability of learning and actually the generosity that everywhere's showing in sharing that learning is really helpful because, as I said, these are decades of disparity and inequalities, and we're finally coming to the table and finally starting to do stuff about it. But I hope that we're going to move a lot faster through this sharing. So thank you very much for sharing that, Paula and Rupert. So now, without further ado, I'm going to move on to the fun bit of the announcement. I haven't got a little drum roll sound bite set up, I'm afraid, but it was quite a tough one to judge actually, and I would say for all of those who submitted posters, well done. It was really interesting. They will be going up on the website for the conference to be shared, and of course today's webinar will also form part of the sharing of the information. But the winner is, Eloise, click forward. So the winner is CAN for the KASIH project. So well done to the CAN team. It was the panel really felt one of the things that kind of tipped it over was there was a really clear evidence of impact. But as I say, some brilliant work from everyone. So if you didn't win the certificate, then apologies, but please take heart, because I am really blown away by what people have shared and the generosity in sharing. And I know that what you've shared today will be taken by people and will learn from. And the nice bit of the posters is it also has your contact details, so people will be able to follow up and ask questions. So well done to Cambert, well done to everyone who took part. So I'm going to just move in now into some final closing reflections to formally close the conference. As Director of Public Health for Birmingham, I have the privilege and the challenge of leading a hugely globally diverse population, and diverse in so many ways. And this conference has allowed us an opportunity to both celebrate what we're doing as a city in partnership, but also to learn from others. And I really want to say thank you to everyone who shared their learning with us. I hope we will run this conference again next year, so please mark it in your diary. I'd love to see more posters coming in, but also even more celebration of sharing. We were intentional in taking an approach which was broader than our African and Caribbean Black communities, and expanding this to really give us an opportunity to learn across ethnic communities and approaches. And I think that has been beneficial. And I hope that we will continue to do it moving forward. I hope that when we do post the videos up on the YouTube channel, you will take some time and have a little rummage and explore, because there is some brilliant stuff there. It ranges from things like a wonderful workshop on how to assess pressure sores in non-Caucasian skin. And I know that led to multiple pressure sore nurses around the country having a new conversation with each other, through to some kind of community organisation interventions, sharing how that they have brought topics like menopause, like prostate cancer, up into the agenda more visibly, both within communities and within strategic partnerships. Sharing from public health departments across the country, which has been brilliant. Some great sessions around the challenges of data, and speaking to that point we were just discussing about how when you've only got a small set of ethnic communities, how do you still recognise the diversity, but also recognise you do need to homogenise to make the case for change? And when you have large diversity, how can you get more granular and go beyond what the ONS and the census tells us to really start to understand in a deeper way people's identities and how they represent that and how they engage with it? And then some really kind of super strategic level thinking around things like a new cultural intelligence framework and a framework for commissioning cultural humility and safety training to really start to build on the existing approaches and take us into a new approach that is deeper and more granular in understanding communities, their needs, and how to best co-produce solutions with them and empower a change with and through communities. So I do commend to you when those videos go live over the next 2 weeks, have a look. There's some brilliant work out there. I hope that through the sessions you've made some connections, you've built some networks, and I hope that you look forward to joining us again in February as we start to do the same approach for our LGBT and T communities, but also put this in your diary for next year when I hope that we'll come together once again over October and really share learning together about how we as a community of practice and a community of people who care and are interested in really turning the dial once and for all, rather than simply accepting decades of inequalities, that we look at our global communities, we think about our local challenges, but by coming together, we really focus on partnership solutions. So thank you very much for your time today. Thank you for joining us across the conference. And as I say, I hope you find the resources that we will share afterwards. A final big shout out to Eloise Watkin and the team of students from Aston University who supported us. A big thank you to all of our speakers. Thank you for you as an audience joining us. Please do the evaluation link that Eloise has put in the chat. And I hope to see you all again at future networks events and that you'll join us again next year. So thank you everyone and have a great week.